Sun Life Financial is proud to partner with Canadian HR Reporter on this roundtable. National pharmacare is a key federal government priority, and finding a model that works for all Canadians is what matters the most. At Sun Life, we support access to affordable medicines for everyone. Visit www.sunlife.ca/national pharmacare for more information.
The Canadian government is seriously considering the implementation of a national pharmacare program. But how exactly would it work? Which model would make the most sense? Who would be covered? What drugs would be included? Who would pay for it? And how would employers be affected? Looking to answer these questions and more, Canadian HR Reporter recently hosted a special roundtable sponsored by Sun Life that delved into national pharmacare, including lessons to be learned from similar programs, the potential impact on employer benefit plans, and challenges around costs and administration. In this video, the second of a three-part series, panelists talk about the role of employer plans and public plans when it comes to benefits coverage and challenges around drug costs.
And I think it's important to recognize that employer plans or union-sponsored plans, association plans, modify their plan design based on sustainability. And if there is an intent to have a private-public mix, then having the prices that are negotiated to be a level playing field for both public and private will enhance the ability for those plans, those private plans, to keep offering benefit coverage, which is an integral, and not just drug coverage, but other benefits coverage, that's an integral part of the Canadian healthcare system.
Sort of added to the conversation too about bulk buying, et cetera, is provinces have been willing to make changes in their plans. Some of them have been unpopular. It was part of some that were, not always well received. But private plans, I would say respectfully, have not. And so it's sort of this notion of, sort of bringing two systems together and trying to benefit from bulk buying, et cetera. But private plans have historically you can have whatever you want, no matter how much it costs. Well, there's no incentive to pharmaceutical companies to come to the table. I know there's lots of talk about sort of jumping in, and certainly what's being published, that would immediately benefit. Well, sure it would, but public plans are set up differently than private plans. Public plans will say, no, that drug doesn't demonstrate the right kind of cost effectiveness or clinical cost effectiveness. And so private plans, I think, have either if there's one system, then fair enough. But if there's going to continue to be these, let's say, two systems that are going to work in parallel, they're going to need to restructure themselves as well to be able to take advantage of some of those tools and combined really around sustainability.
That discussion has been happening more and more, and it goes back to the comment on sustainability, that as costs become increasingly unsustainable, employers or associations or unions who sponsor private plans become more willing to talk about those types of changes. Partly now, it's increased in cost enough that it's getting the attention, but plan sponsors aren't really sure how to manage it without restricting access to employees. And so the public formularies cover a list of drugs. The private plans enhance that list. So the employers and private plan sponsors need that flexibility. They need to be able to say, you know what, we're having an issue attracting and retaining employees in this sector. We want to make our benefits plan, our retirement plan, our compensation top of the tier so that we can get people in. So I think it's important to recognize that the design partly flows out of that compensation model. The benefits program isn't just about health insurance, it's partly about compensation. That it has to be affordable to both taxpayers and to businesses. It just has to be. You can't just suddenly transfer all of the cost to private sector. You can't suddenly transfer all of it to public sector. The area that we're seeing private plan sponsors struggling with are those high cost drugs.
I can't agree more with Jennifer. If there's an area of opportunity for a government intervention being first payer, first claim, first dollar type. Wherever you define the threshold, and that can be defined in dollar or maybe in volume of or prevalence of disease or what have you, that's an area where we see our clients struggling.
I think like we use the word sustainability often in the context of fiscal sustainability, but I think what this is revealing, and it's I think it's one of the paramount concern for any design for a national pharmacare program. It has to be forward-looking. In the last few years, high-cost drugs, and I don't necessarily want to pick a threshold for what that is, but the high-cost drugs relative to what we used to know, the blockbusters that were relatively affordable, are creating pressure. And it's not just in Canada, it's around the world. So we're really at the crux of redefining, again, the viability of the business model, largely defined, I would say, government's business model, industry's business model, insurers. How do we make sure that at the end of the day, what Canadians want, employees want, is the best standard of care?
All pharmaceutical plans, whether they're single payer, whether they're multi-payer, whether they're first dollar coverage or catastrophic coverage, whatever, are facing the pressure from these niche drugs that are now being required and that we see a trend towards as well.
Those ultra high cost drugs, almost needs to be a universal first payer. Everyone has access to the same list of drugs across the country. And that helps employers or private plan sponsors have a robust system with a reduced level of risk. And then a second tier that is that financial protection against hardship for out-of-pocket costs that can be part of a private plan or a public plan. So I think those two things, so it's not necessarily one pharmacare system. I think you have to look at different types of pharmacare based on the different types of needs.